video is designed for people who are due with their babies in the next couple of months. Hi, this is Midwife Becky. It's been a little while, but here we go. You have planned for a hospital birth, but as the events of 2020 are starting to unfold, you are starting to wonder whether the hospital is the best or safest place for you to plan the birth of your baby. You are starting to watch the news, both locally and in other places and countries, with some trepidation and concern as things are unfolding and progressing. Here is what this video is going to tell you. What options there are available to you for birth in an out-of-hospital setting, how to go about finding those resources, and what you need to do to prepare. First of all, take a huge deep breath. Your baby doesn't know what's going on in the outside world. The only way you have to comfort your baby is to downregulate your system and talk to your baby and send little messages of oxytocin. So when you're feeling agitated or stressed, it's okay and a good idea to talk right to your baby. Hi, baby. It's gonna be okay. There's a lot of hard stuff going on out here, but your other parent and I are going to take care of you to the really best of our ability. Remember that it is a wonderful, joyful thing that you're doing, bringing a child into the world, even when there is a big sense of concern and stress and a big fear of the unknown. So right now I'm going to start to get practical. So I wanted to discuss what options you have available. So typically there are 3 locations that people consider giving birth in the United States. Number 1, the most common, is in the hospital. Number 2 is an independent freestanding birth center, and those are available in some communities. And number 3, people give birth at home. Now, a couple of generations ago, almost everyone gave birth at home. My grandparents were born at home, both of them. But in the transition time between their era and this era, it became the most common for people to give birth in the hospital. So the details of what is available are region specific. So you are going to need to do some detective work if you want to explore other options if the hospital is not looking like the optimal place for you to give birth, or if you feel like you would like to decrease some of the requirements on the hospital. In your area, like I said, there may be independent birth centers. Those would be and are usually staffed by and run by midwives. But it's specifically important to make sure that they're independent and not affiliated with a hospital if that's what you're seeking. Because some hospitals also call their labor and delivery facilities birthing centers. Not a problem, but it's just if you're seeking an out-of-hospital situation, then you need to explore your options. So the other place to consider giving birth is at home, in your home, the place where everybody's being recommended to stay as much as possible right now. You would be supported by midwives who come to you in your home. So how do you find these midwives? The first thing you can do is use the internet. Whatever your search engine is, use the internet for your search process. The easiest way is to use a geographical location, place name and midwife, place name and home birth, or place name and birth center. For example, I live in Loudoun County, and so I might do Loudoun, Virginia home birth, or Loudoun, Virginia midwife, or if I wanted to consider a birth center option, Loudoun, Virginia birth center. If you live in a town or a city, I don't, I just live in the county area, but if you live in a town or a city, then you can just use the city or town. For example, the town of Leesburg, Virginia isn't too far away from me, so you could try Leesburg Virginia. Don't try Leesburg, Virginia, unless you're in Loudoun County. But you know, St. Louis, Missouri, or St. Louis Homebirth, or Los Angeles Midwife. So, as an example. So you might wonder what health criteria you have to meet to be able to plan an out-of-hospital birth. So one thing people don't realize is that most pregnant women and birthing people are in a health category to plan an out-of-hospital birth. There are some health conditions which might need to be taken into consideration, but the percentage of people who can plan an out-of-hospital birth is quite high. Also, some things that are considered risk factors don't necessarily risk you out of home birth or birth center birth. It's just important for you to determine whether you fit those categories as well. For example, diet-controlled gestational diabetes may be okay if you have a glucose monitor and you're monitoring your sugars regularly and continuing to see that everything's in the normal range. Also, maternal age may not apply if all other health factors are healthy and you're just an older pregnant person. Also, if you have a previous history of cesarean section or other lower abdominal surgery procedure, you may or may not be able to qualify for a home birth based on the requirements in your area. Some of those guidelines are actually state mandated depending on what your location is. So just based on the examples that I gave, you can see that there is some flexibility, or there may be some flexibility about where you can give birth based on your own circumstances. The people who can help you determine whether you're a good candidate for out-of-hospital birth are the midwives in your area. They're familiar with the state statutes and local regulations that guide their practice. And so I would reach out to them and see if you're a good candidate for out-of-hospital birth, if that's something you want to research. Okay, what availability is there? Again, this is area specific. In some areas, home birth midwives and birth center midwives already have their calendars booked. But in some areas, they are ready to receive late to care transfers. So even if you're 35 or 36 weeks, you can do a little bit of research and determine whether there's a midwife or more than one midwife who's available in your area. I have several midwifery friends across the United States, and many of them have indicated on their social media and other places that they are available and ready to receive late to care transfers as long as you have received midwifery care with another practice. OBs, midwives, it doesn't matter. If you have been receiving care throughout this pregnancy, then that is one indication of a lower risk pregnancy. So what I can tell you about is availability in my area, in Northern Virginia and Maryland area. And there are both birth centers and midwives supporting home birth in my area. So you would need to reach out and see what's available in your area. Okay, so what should you expect? You are likely to find that your appointments with your midwifery healthcare provider are quite a bit longer than with your hospital-based provider. Part of this is because if you are coming to us late in care, we have a lot of material and informed consent to cover with you to make sure that you understand how giving birth outside of the hospital is a different situation. One really important thing is that you should expect that your midwife does not have pain medications. What she should be able to do is offer comfort measures and birthing positions and other exercises that can help get the baby into a better position for a smooth birth. She does have a lot of tools up her sleeves, so this may be one of the hardest things to process. If you were expecting to use an epidural to manage the pain of labor, then you're going to need to go through some mental shifts, and you will need to move into a place of acceptance for the changes in your birth plan. It's also true that as policies get tighter and more restrictive in a hospital setting, Very often, a support person such as a doula may not be available, and in a few cases, maybe even your partner, your spouse, or your life partner will not be able to come in with you. Your midwife is trained for this situation. She expects birth to proceed normally. They may ask you to participate in some sort of online childbirth education classes to prepare if there's time, or they may provide some sort of books or websites for you to look at, videos to watch, hopefully all from your phone or from the comfort and safety of your own home. You should expect that your midwife will have some protocols in place to minimize the effects of infection on you and on her. You should also expect that some of your appointments may be virtual or via telehealth. You may need to go to her office, or she may come to you, and these are going to be practice specific. Some out-of-hospital midwives are limiting home visits as much as possible to protect themselves and their families, and others are only doing home visits so that they have a very small patient contact. So what credentials does a U.S. midwife have? Now I have to be clear and reiterate that I am speaking about midwifery in the United States. That is what I am familiar with, and I am a U.S.-based midwife. So in the United States, midwifery is legislated at the state level. In some areas, there are certified nurse midwives who are advanced practice nurses with a master's degree or doctorate in midwifery. Some of them practice in hospitals, some practice in homes, some in research, and some in other places. There are also certified midwives who come to that path from another education background separate from nursing. Another group is certified professional midwives. That's my credential. And they have either attended school or done some combination of school and self-study, all with apprenticeship components and lots of birth and prenatal and postpartum experience. All in out-of-hospital settings, and then all take the same certifying board exam. In some places, there are licensed or licensed direct entry midwives. In some places, this criterion is just the state designation for certified professional midwives. But in some places, licensed midwives have a separate set of requirements, apprenticeship, and a state approved board exam that they legislate and manage at the state level. There are also direct entry midwives or traditional midwives. They usually have tons of experience. Most of their knowledge comes directly from the apprenticeship model. They have been working with a senior midwife for a period of time, usually several years, attended lots of births. They may work with traditional populations, for example, Native American tribes, or with plain folk, such as Amish or Mennonite populations. It can seem confusing, but the truth is that all of these paths can give you or your community a strongly qualified care provider, a midwife who is knowledgeable, skilled, and capable of providing excellent care in a non-hospital setting. A lot of people are worried about what if something happens during the birth, and that is why they feel most comfortable birthing in a hospital. I often say that birth is as safe as life is. There is always some risk, regardless of the birthing location. A lot of times when things are compared, the risk are not compared, but risk and benefits. And it's important to understand that every birthing location has risks and benefits. What midwives do with many situations, like what if something happens, is to manage the problem on location. Many midwives have lots of different trainings, such as neonatal resuscitation, expecting the unexpected, and birth emergency skills training. Some of the emergencies or what if something happens can be managed in the home setting by the midwife skills. If it becomes too problematic or more emergent, then we always have the opportunity to transfer to the hospital for higher level medical care in whatever stage of pregnancy or labor you may be in. So true sudden emergency transfers are really uncommon. They do happen, and usually your midwife would tell you right away, this is something that I cannot manage in this situation. They're probably going to transfer with you in some sort of supportive way, whether it's listening to the baby's heartbeat all the way to the hospital or supporting you or the labor in some way. They will communicate directly, concisely, and tell you what's going on. So if we are to decrease the load on the hospitals, then what the home birth and birth center midwives are offering is the opportunity to transfer some of the low risk patients, or we often call them clients, to out of hospital care. It decreases the burden on the hospitals, decreases the risk of infection for the individual, her family, and her baby, and supports people for whom labor and birth already don't have to be medical in most circumstances. So what about breastfeeding? Most home birth midwives have excellent lactation support skills. We believe strongly in the physiology of birth, and lactation is the final step after the stages of labor to help the birthing person's body come back to a good homeostasis place. It is hormonally supported in the process of labor, birth, release of the placenta, and is part of the normal postpartum recovery time. In fact, many home birth midwives will strongly encourage their clients to breastfeed for at least a short period of time of a couple of weeks, even if they are considering other feeding methods long term. That's because the process of breastfeeding helps involution, which means the coming in of the uterus as it closes down after the baby is done being inside. If we do need advanced skills resources, most of us have community connections with IBCLCs or lactation consultants who are often using telehealth or virtual consultations to help so that they can come into your home without coming into your home. There are also some lactation consultants who do home visits and may choose to continue doing that during this epidemic time. The next question I want to discuss is how to get ready for a home birth. At this point, you might be interested, but you're still curious about how do I get ready for a home birth? So I am going to actually move that process into the next video because this is getting pretty long, but the biggest getting ready is a mental shift. There's more of your participation in the preparation and all of the process. Your acceptance that your body is amazing and is likely to do this birthing process well. Developing your resilience and adjustment to this change of plans, and developing your faith in the process of labor and birth. And just note that midwives and also doulas are especially good at supporting this process of accepting that labor and birth are normal and can go well in and out of hospital setting. Pregnant and expecting friends, I know that right now is a time of intense uncertainty, discomfort, and emotional stress. As a home birth midwife, I wanted to offer you this information as you consider all your options for maternity care so that you know the whole picture. Please reach out to your local midwifery community if you have specific questions about how they can help you. Look in the description below to find lots more information about how to find a midwife, midwives in your area, different types of midwives, and different policies about home birth and out of hospital birth. I strongly encourage you to consider all your options. But most of all, cultivate a sense of peace and resilience in this time because your baby needs you to help cultivate that for them. God bless you. It will be okay. Thanks for stopping by Midwife Becky's Homebirth channel. If you have more questions, you can watch more of my videos. You can talk to me in the comments below. You can contact your local midwives. Good luck.